Making a difference in healthcare requires collaboration between researchers, startup founders, and policymakers. This is what Delta is about, hosting conversations with leaders on the path to serious innovation. Hello everyone, my name is Rupen, and I'm a physician on a journey to meet people who are making a delta in healthcare. Hello everyone, and welcome back to another episode. As you know, physicians spend hours and hours writing notes after they spend 10 minutes with a patient. And documentation has been a big issue in healthcare, and many people are trying to solve it. But today, I have a very special guest with me, a physician who's an entrepreneur to tackle this problem, Dr. Kelly. He's the CEO of Heidi Health. And Heidi Health is an AI Scribe tool that I used in the past, and I have a review about it. You can check it on my YouTube channel. And today we're going to talk about Heidi Health and his journey to becoming a physician entrepreneur. Dr. Kelly, I'm so excited to have you. Welcome to the show.
Yeah, hi Ruben. Tom is fine. Don't worry about it. Don't worry about the doctor. So excited to be here and tell you a bit about Heidi and myself. Yeah.
Yeah, same here. I'm very excited to have you today, and I've been following your journey for a while. And I tried Heidi Health in the past, but I want to hear from you. Can you tell me what is Heidi? What does it do? And why the problem it's solved, it's a
Yeah.
huge issue right now in healthcare.
Yeah. So in a nutshell, Heidi writes amazing notes, listens to visit, and writes notes ideally better than you could, just the way you want them written. That's what it does today. I think it does it better than most products out there. And probably the bigger ambition is more just can I give every clinician an AI resident or a junior doctor or podiatrist or nurse or whatever you need in the room to support you in your task and sort of leave admin at the door and let you go back to the old fashioned way of doing medicine, which was, go see your patient, solve the problem and move on to the next one. And let Heidi document and draft orders and automate all those annoying next steps in the records. Yeah, so that's the ambition, but today it's all about writing just mind-blowingly good notes.
Gotcha.
Yeah, that's
So
it.
when I tried Heidi, I think several things popped to my mind. And then you mentioned also the giving every physician a resident or a junior resident, someone who can do the grunt work. Let's put it that
Yeah.
way. So there was also some part of it that is customization. The product was customizable to my needs. Can you talk a bit about why this is important in healthcare and why it's important to customize notes, and every note is different than the other?
Yeah. I think so. I try to think of most things in the way that they're practiced. So, if you had a resident following you around on rounds, or maybe you're admitting a patient, they're listening to the visit, they're trying to figure out based on what you're saying, what you're thinking. It's like they're trying to read your mind, and they're trying to interpret. Okay, he's palpating the abdomen right now. He said that it feels soft. So what he's saying is there's no peritonitis, or it's not peritonitic, or he's not concerned about an acute surgical abdomen. Like this kind of inference that happens on top of what you hear out loud. And then on top of that, the junior that's following you around writing also needs to learn from you over weeks and sometimes months what your preferences are. Do you prefer your notes written in real shorthand, extremely information dense, 2/7, CP, comma, SOB, all very shorthand? Or are you the kind of doctor that wants very thorough notes that are written properly and in full sentences and without dot points? And as we all know, every attending will have different quirks and preferences and structures and templates and whatever that they want.
I completely agree with that.
Yeah. So when we set out to build a product, that I wanted to give people that level of flexibility, down to the sentence. On Heidi, you can make it so that every template starts with a handover sentence, or even within the sentence writes it in a certain way. I just saw a patient PT that presents PX with comma, and then insert in brackets patient problems in acronyms in brackets. And then this very detailed kind of borderline pedantic level of customization, I think is just how clinicians write. And so to make Heidi function as a great resident, you have to give it that level of flexibility. So yeah, that was the inspiration for making our templates extremely, extremely customizable. And based there just sort of all the doctors that I used to work with, and what would Heidi have to do to be able to write their notes. And I think that's why being clinician led in this product category is quite important. I think like it's, being a doctor is hard. There's a lot of lessons you learn practicing, and I always try to stay close to my experiences, but also the experiences of our users and what we build. Um, yeah, so I think again, I don't know, but like my intuition, although everyone still today is posting articles and thinks that note writing is a commodity and it's going to die and whatever, I still think in the next 2 or 3 years, there's still a lot of room to just write way better notes. Like a lot of doctors hate the boilerplate AI stuff. It's like if you write a letter or a blog article or a podcast script, anything
Yeah.
that with these AI tools, they're kind of a bit mid, like they're a bit middle of the road. They're not great. They're kind of like maybe a 4 out of 10. So for it to replace the doctor's writing has to really be at a high level. Yeah, so I think customization is a real key to getting people to use it and stick with it. That's the reason we do it. I wish all the doctors were easy and they just all have the same templates, but they're not.
Yeah, I
and
completely agree with you. This is
and
one of
yeah,
the things that drive
yeah.
me crazy. Yeah.
Yeah, and again, back to this whole resident analogy. When like I only worked as residents for a little bit because I worked as in Australia called a registrar, so senior resident, junior resident. So I'd only just gotten to the senior resident before jumping to Heidi, but it takes a while. Like it takes months sometimes for someone to really know you and like feel how you like to word things or what orders tests you like to do or how you like to structure your word round, all this stuff. So I think it's similar with the best product in this category is going to be like that. You can pick every little detail down to the soup to nuts, like down to the way it writes, to the languages you can handle, to the structures you use, to the downstream documents you want. And what I see in our category, which is obviously very competitive, is that everyone is so focused on everything else. So like trying to get ahead on integrations and trying to do like patient intake and trying to do AI patient summaries and like all this other stuff. But at the end of the day, like the magic is if you see it write what you would write. That's the hard part. All the other stuff is kind of like the wrapping. But if the note isn't great and it's not listening and really stable recording, then the rest of it kind of falls down. Like it all relies on you using it every time, which only works if it's extremely customizable. Yeah, that's
Yeah,
my
I
that's
completely
my
agree
point of
with
view.
you. I think the end of the day, it's like at the end of the day, sorry, it's not writing. Like there are some products that they do pre-authorization or like filling patient form or like people like right now are like looking into different things. But I think at the end of the day, I need a tool that really writes a note that and save me time because like I will be honest, if I see 5 patients, let's say in the morning seeing patients take an hour, writing notes take 3 hours. Like that's the most part of it, and that's like that's the hardest part.
Yeah.
And you mentioned that so you mentioned something about like people are writing articles and posts about the future.
Mm.
So I'm sure you have also like plans for the future for the product itself. Like what are you guys are planning to do like right now? You're helping physicians or clinicians. Like what are the future plans for the products?
Yeah. So some of these already have in production in some settings. So yeah, so one is being able to take unstructured notes or unstructured visit and insert it into a structured codified format. So a lot of practice softwares or medical records, usually in the early 2000s, they realized that doctors hate typing. So what they did was that they make everything clickable. So if you want to add a diagnosis, you click the diagnosis. You want to add clinical notes, you click observations, normal. But what happened is that there's no free text. Like you literally cannot write into these systems. You have to pick from drop-down menus and dialog boxes what you want, which made sense for the time. It made sense. Like that was the fastest way to stop people typing was to click. But unfortunately, now we have an ability to write everything they need in one shot, but we have to somehow fill into this structured data set that the EHR has defined. So yeah, we're doing that through two main ways. One is integrating with like hundreds of different records. So all of your major ones, we have integrations live with at the moment. So that's like your Epic, Cerner, Veradigm, Allscripts, uh, Athena, like all of the major ones we can now set up integrations with, which is great. So you can click a button in Heidi, send it back, and it goes in a structured form. Um, but probably more than just that, I think is, and this is something I'm really excited about, there's two main product features that we're going to focus on for the rest of the year that I think are amazing and I haven't really seen people focusing on. So one is guides, is what we're calling them. Again, it hasn't been released, so it's still a bit of vaporware. But I promise you, it's cooking at Heidi. So basically, letting you apply any guide to your notes. So that could be a clinical decision support algorithm about, like I don't know, in oncology, for example, Ruben. Like I'm sure there's so many different guidelines in the
Oh,
practice places you
tons,
work
yeah.
about. Yeah, yeah. So depending on the condition, there's like all these different investigations you have to order, or to diagnose like this subtype of a leukemia versus another. There's like certain criteria that has to be met. So basically, we want to give, again, similar to Heidi today, we want to give people a lot of configuration options to build these guides themselves. So you can upload guidelines, you can teach us different rules, different scenarios of how to apply them to your notes. And then you can choose to either turn them on all the time. So as the visit's happening, we're surfacing relevant insights from the guides, or just at the end, when you generate your document, we can provide a kind of referenceable summary of things that we've inserted. So an example would be, in this world, we could support some management and diagnosis work because we could reference a guideline. Today, we don't do that because obviously we don't want to be a medical device. But if you're applying your own guides to it, then we could say, here's a guide you built. According to this guide, this is the appropriate diagnosis. And you tell us yes or no. And you tell us this is the correct management plan, and you approve or deny the recommendations. And then obviously Heidi tries to learn from that what are the correct sources to find for different kinds of notes. There's also billing, like CPT codes, ICD-10 codes, referral pathways. There's basically unlimited different kinds of guides that we'll let people build for themselves. So that's one feature I'm really excited about. The other feature is multiplayer. So often as clinicians, we share our notes with each other, or we refer to one another, or you see a patient over multiple days in an inpatient setting. So the simplest version is just, can an administrator see all of the sessions being done by all the doctors? Like imagine an outpatient clinic. Now one of the attendings can see all of the residents and all the visits that are being done and all the notes that are being created, and perhaps apply their own template. Like, have they asked about this question or that question that I know they always forget about? Or like basically use Heidi as a way to see what's happening inside their clinic room. But then also things like linking together multiple patient sessions. So if a inpatient has been seen by trauma and seen by the OT and the PT and the social worker, selecting those sessions and then filling a progress note for the next day based on what happened in the previous day, and filling in all the relevant
Oh,
parts
wow.
from the
That's
from the
so
historic.
summarizing the
Yeah,
events that happened in like the last 24 hours.
correct. So you can have a progress note that, and again, the hard part with this is we want to have references because we don't want to obviously make mistakes where we're
Yeah.
not,
Yeah. Yeah.
where you're not looking through it anymore. So we want to have clear references and say, yeah, this is where, like, social worker said happy to discharge, PT said happy to discharge, and we have references where you can click and look back into the record or into Heidi's context and see what was said. Yeah, so when I say multiplayer, that's what I mean, like teams within the hospital or a health system. And I think of it like it's almost like Harry Potter, like with the moving pictures. It's like referral letters used to be like a static thing, like you send a referral and that's it.
Yeah.
Whereas
Yeah.
now you can almost look back into the past and see what actually happened in that visit. You can query Heidi, like, did Rupin review the bone marrow aspirate in this visit? And then we look at the transcript and say, yes, we did, or no, we didn't. So obviously lots of compliance things there. Like when we sell to health systems and hospitals or clinics, they have to decide whether they want to retain transcripts or not. If they don't, then obviously we can't do some of these things. But yeah, that's what we're excited about. Basically getting integrated, being able to apply guides to notes, and kind of these like multiplayer, multi-session usages of Heidi are really interesting. That's kind of the next few months to a year, probably making that really, really good. And then probably, yeah, later, like middle of next year onwards, definitely start to think of things outside of the visit. So what do we share with our patients, like patient explainers or post-visit summaries,
Oh yeah, that would be
or
cool.
maybe like a personal patient record, I think. It's kind of interesting where they can ask questions about any visits they've ever had on Heidi, and then that can give them referenced answers to say like, yes, Rupen did say this or didn't say that. And then as a clinician, you can review all of Heidi's conversations that are happening with your patients and approve or deny things. Like Heidi might come back and say, hey, um, blah blah has asked for a repeat here, or blah blah has, so try like basically trying to manage that like patient messaging that sometimes happens on my chart or something like that could potentially happen
Wow.
on Heidi. Um, yeah, so I think, but to me, that's still downstream. Like that only works again if people are using it in their visits. If people are using it in their visits, then yeah, like sharing with patients makes sense. But there's enough juice still, I think, in the just getting it to be like the best side by side tool that we can. Oh, and then one other thing, sorry, a lot of different things, but one other thing
Yeah,
is
very exciting.
yeah, what having like a desktop app and a Chrome extension that lets you kind of feel like Heidi is integrated, even if we don't have like a real integration. So being able to run Heidi on the same screen
The
as your
desktop,
other
yeah.
software. Yeah, yeah. Or like while you're using your record, you see your little Heidi recorder and it lives with you on the same tab. You don't have to have two tabs live. Stuff like that. Just make it more usable and easy. Yeah, that's kind of it. That's what we've got on our roadmap for the next couple of years.
Yeah, I think that the desktop icon and the desktop thingy would be great because like it would be nice to run in the background. Like it's because like when you go to, I will tell you my pain points. So when I go and see a patient, I'm using those AI scribes. So it's nice to have the phone app, but also like I usually go with my laptop, and
Mm,
I'm already using my laptop because like I open the electronic medical records. Of course, different physicians have different ways. So it's nice to have like both options. Like if some physicians go and see a patient and they only use their phone versus like some physicians like me who go and see a patient with their laptop. So instead of like recording on my phone and the laptop, so I can use my laptop to browse the EMR and I can use the laptop as well to like use Heidi and run that transcript in the background. Yeah, so that would be
yeah,
very, very cool.
yeah, I think so. We just want to give people multiple different ways. So phone for
Yeah.
sure, but yeah, the most common thing, like we get these really funny, sweet feedback, which is like the worst part of my day is when I forget to click start on Heidi. Like
Yeah, yeah,
like
yeah.
an hour visit or something, and I forgot to start Heidi, so now I have to write my own notes and things like that. So yeah, we just want to make it very easy to kind of
Gotcha.
automatically start. Um, uh, yeah, and then I think like one thing I'm excited about is as we ship more product, we can keep making the free better. Because there's
Hmm.
this balance where like you want to make the free really good and like get people to try and
Use it,
experience what
yeah.
these things can do. Yeah. Um, so today, like doing custom templates is a paid feature, but I definitely think once we have like guides and multiplayer and a couple of other features out, we'll probably make at least let you have a few custom templates for
Hmm.
free,
Hmm.
maybe even try like one guide for free. Yeah, so it'll just be cool. Like we'll slowly keep making the free better and better because we always want to give as much as we can away for free. Because there's all sorts of like, I don't know, there's people who just can't afford or won't pay for these tools. So it still
Yeah,
makes sense to
yeah.
us to get them to use it. And then there'll be some cool paid things that we sell to both individuals but also to organizations as well. Yeah.
Yeah, I really like the idea. Also, like you guys have a free plan, and like an individual physician can go and try the product themselves.
Hmm.
They don't
Yeah.
need to wait for XYZ hospital to buy the product so they can use it. And I think that's the best thing in general in your products, or like not the best thing in general, like in the AI Scribe market, that there are some people, or I would say in most of SaaS, like right now entrepreneurs are becoming aware that it's much more easier to sell a single physician rather than selling an entire organization.
And I think so we see kind of the opportunity both. So we definitely like there are things that we can do for organizations that maybe individual clinicians wouldn't really want. So that's things like your billing optimization or prior
Hmm.
authorization, or um, linking in with administrative support for clinicians. So I think there's this like linking together the hospital with Heidi that is really cool and something we can do. But yeah, like you're right. Like I love the idea of um, kind of being like the pirates, not the navy. Like if clinicians
Yeah.
want to use this, then like they should just use it. Like I used to use tools that the hospital didn't always 100% approve of, and I think it's important because it creates a natural tension. If there's no tension from the individual users asking for something, then it's very hard for
Yes.
any
Yes.
large
Yes. I completely agree.
organization. Like it's super hard, right, to create the incentive for a 1,000-person IT and security organization to approve a tool. It has to have lots of groundswell. Yeah. Anyway, so we're still doing both. Like I think there's about 10 top 25 health systems that are in some stage of like piloting or contracting with us, which is super exciting for us. And they usually started from people trying the product or testing the product against a few others and preferring us. And then that it takes a long time. Like it might take years, but it goes from individual users, they still using the product, advocate for us, and then we slowly win large organizations. But yeah, it's fine. Like we happy to serve both. Makes sense to us. Yeah.
Amazing. I love it. I want to switch gears now and I want to talk more about you and learn more about your story. How did you end up being here today? So, take me back to the old days. One day you had the idea of Heidi. Like, what did
Mm.
you do? How did the idea come about? Like, what did you do next? How did the company all started?
Yeah. I think so. For me, it started back when I was studying maths. So my undergraduate, like before studying medicine, I did pure and applied maths. So um, what if you've seen Goodwill Hunting, that kind of thing, like weird problem, you're solving in pen and paper, that kind of thing, or pencil and paper because you have to rub out all your mistakes. And yeah, we learned like the kind of written theory of some of these neural networks back then. So things like Taylor series and gradient decay, and like a lot of the algorithms that that systems to train neural networks use, I learned like the pen and paper maths of like how it would work. Basically, because neural networks start off with like basically like a computer version of neurons, like a brain analogy, and then you show it input, and then you tell it what you want on the output as an expected thing, and then you run a reinforcement loop on the neurons and change the weights, and then you do it again, and you do it again, and you do it again, and eventually the weights somehow preserve some of the data of what you trained it on. Kind of like that's my very noob explanation of how neural networks work. So anyway, so I learned a lot of the maths of how to do the reinforcement part, like how to modify the weights to try to get better at prediction. Um, so I was always obsessed, like forever, this obsessed with like how AI was going to change the world. And I'd read all the books, I'd watched iRobot, I'd all the Isaac Asimov books, the Frank Herbert, all the Dune books. Like I always loved sci-fi. So I definitely thought it was something I was passionate about, independent of what I was going to do in my career. And then going through medical school, I had a really cool opportunity to help run kind of like an MCAT business, equivalent kind of thing where you're helping people get into medicine, do the tests. And while we were there, I had an experience using intent and entity-based systems. So that's like your basically chatbots. And I couldn't believe how good they were. Like even back then, I was like, wow, these are pretty good. Like, yes, they're not perfect, but they can kind of do a patient doctor history. Like I can make a chat that pretends to be having a heart attack, and I can practice taking a history from them.
Yeah,
Um,
yeah, yeah, yeah.
yeah, so we experimented. Like we built like little products out of it, and we built a product called Oscar, which was like a OSCE tool that you could share with students to practice taking histories from their laptop, so they didn't have to coordinate with their friends. And so that was like kind of the first dip in, and then in 2019 was when I was first like a senior resident doing lots of outpatient clinics, and it was like something else. You'd have like 60 to 100 people waiting to see you. all the attendings were in theater, and like no one was there to help, and it's just this poor person has waited sometimes 6 months to a year to see me because it's a public system, and I'm trying to like rifle through like all these pages of like things they've done, investigations, and like try to come up with a good plan for them, and then either get them to come back and see us again, or send them off for investigations, or whatever. And you have to do like, I don't know, 10 visits an hour if you're going to get home on time, which is impossible. So you just don't get home on time.
Exactly. Yeah,
So
no way. I know.
yeah. so so I think at some point in there, there wasn't any like one like light bulb moment. I started to realize like, wow, I feel like the stuff we had experimented with could maybe do some of this work. Like maybe it could write my notes, maybe it could generate some documents. And I think we experimented with BERT, which was one of the large, it was like a biology encoding something transformer from Google, one of the early like big transformers. And it was pretty good. Like you send it, it could classify information pretty well. And I think some of those technologies were the basis for a lot of the earliest products in this space. So like your Nabla or Suki or Deep Scribe or Bridge, they all kind of started in 2019 because what happened was this tech made this all of a sudden possible. You could
Gotcha.
you could you could kind of like classify everything that was happening in the transcript, and then using like a knowledge graph or some other structured approach, write a decent note. But it's kind of brittle. Like you had to, like the transcription had to be really good because if you made little errors, then it would stuff up all. It was like a Fabergé egg of like different things that had to work for the note to appear. Um, but I think where we were different was when we started the company in like kind of end of 2021. GPT-2 and like I think it was called Da Vinci was just released. So the earlier versions of what OpenAI ultimately released as ChatGPT, but just the model like was an API you could call. Um, so we kind of made an early bet that Gen AI approach was going to be the way to build this product, not necessarily like the because we'd failed before. So we learned from scar tissue that like this structured approach was very brittle, and all I would ask for is like I wanted to write my notes this way or that way, and it just couldn't handle it because it was too structured. Anyway, so long story short, basically my outpatient clinics inspired me to build it. I'd done math. I was really interested in the category. Um, I was lucky from my business experience, just like fortunate to have engineers and have friends who I could prototype things with. So some collection of like, I don't know, ambition and like grit with a bit of kind of happenstance and luck that that led us to ultimately try to build the product. And then yeah, I haven't looked back since.
I love it. And you mentioned something also in your conversation. You had like friends and like people who help you build the product. So as physicians, we don't get really exposed to like the business side of medicine. But you mentioned that you have some business background. Did I hear that right? Because like I want
Mm,
to touch base on how did
yeah.
you get that background from?
Yeah, so I think it started for me as a part-time job. So I was doing tutoring for the Australian equivalent of the MCAT. It's called the GAMSAT. Um, so yeah, I was just doing tutoring, kind of paying for trips and my rent and all that kind of stuff, as you do as a 22-year-old, 23-year-old. And yeah, it was just finding that like we were getting lots of demand for tutoring. I guess like people obviously liked me as a tutor, so that was really growing. And then I made some YouTube videos again, kind of sporadically. I just like cameras. I thought YouTube was kind of cool, so I made these YouTube videos in like 2014, 15, and then yeah, just kind of again a bit of luck. Like lots of people watching those videos. I was getting more students that I could handle, and then I spoke to Waleed, who's one of my co-founders now, and then Scott Fraser, who was also running a tutoring business. And then we eventually partnered up to serve the students together, build a bit more of a structure around it. And both Scott and Waleed had worked in business in the past, so I learned a lot working with them, how they everything from doing contracts to hiring people uh, to how we think about strategy and pricing of a product and launching a website and all the kind of business, like kind of earned and learned MBA like stuff
I
that
know. This
you
is the
just
best type of
yeah,
MBA.
yeah, just learn by doing. Yeah, so we just tried to start a tutoring business and learned as we went. That was the key.
Gotcha.
Yeah.
Also, you mentioned about building teams. So right now, let's say I'm a physician, I'm listening to this the first time. What advice would you give me on building teams?
Yeah, I think so. Probably even before building a team, and this is like what has always driven me has been um, it's kind of like intellectual curiosity about things. So, for example, and I guess not creating like artificial limits on what you think you can do. So just because you haven't trained as an engineer, it doesn't mean you can't. Google like how would you set up a software product, and then you learn about what a back end is and a front end is, and then okay, if I wanted an AI to write something based on a transcript, how would I do it? Especially today, it's so much easier because now you have these AI tools. So
Yes,
they'll teach
exactly. It
you,
can help you. It can answer
yeah,
you.
yeah, they'll teach you exactly how to do it really quickly. And I think that's the best way to be able to build a good team or to find people that can help you, because it's quite hard if you start your process with an idea and then you just look for an engineer, but you've done no work yourself. Like it's just an idea in your head about, I don't know, let's say you have an idea for a certain cannula and it should be shaped in a certain way, and you're trying to find a product designer and a industrial engineer to help you actually produce like a first prototype or 3D print it or something. My instinct in that scenario would be to try to figure it out myself, like go as far as I can without actually having to need anyone else, because no one is going to care about this idea as much as you will. So you have to push, like even if you're not available, it's hard, or you've got your kids or whatever. Like that's like the first kind of like threshold. If you can get past, like that's a life or death threshold. Like the idea has to be good enough that you're willing to go over and above in your nights, and like you're doing, with this channel and building up. Like we're all busy, but you can find time for the things you really care about. Do research, get enough depth that if you speak to an engineer, you can kind of suss out, is this person trustworthy or not?
Yeah, understand what
And
they are
then you,
saying, understand the
yeah,
language.
yeah, exactly. Because that's the hardest thing. Like you're going to have to vet, is this someone I want to enter into a marriage for 10 years with to try to get my
Exactly.
company alive. And yeah, then the best way I would say, if I didn't have my lucky set of experiences, I would have gone to like accelerators or to clinician entrepreneur groups. I think you have to be really careful about the advice you get in those scenarios, because sometimes there are a lot of grifters that haven't really done it that are teaching those sessions. Like the teaching the sessions is their business. It's not that
Yeah,
they've
exactly.
done the
They do
thing
the
before.
theoretical
Yeah,
part, not the practical part.
yeah, but so lessons aside, but the network you can build in those scenarios is really good, because you'll find other doctors working on similar problems. You'll find scientists and engineers who are looking for projects in healthcare because maybe they have a personal connection to wanting to do something that has impact in the world, or wanting to do something in medicine. Um, yeah, and I did that too. So I think like 2 or 3 different hackathons during medical school. There was this like med hack conference. I met different engineers through that process. So it was definitely, yeah, it was something I was doing before even starting Heidi, because I was interested in it and wanted to build up a bit of a network. Yeah, it just takes time.
Oh, that's so. What advice would you
uh,
give a physician? So sorry, go ahead.
no, I was going to say I forgot to talk about a team. So yeah, so I think once you built up some subject area, maybe not expertise, but like you've got some awareness, um, then yeah, I think it's just a matter of like networking, starting to talk to people. Really, what you're trying to find is in that early stage is kind of like a co-founder or someone who's willing to go on an exploration with you. Should be
Mhm.
unpaid. You shouldn't have to pay them. Should be
Yeah,
outside
exactly.
their
I
work
completely agree with
hours.
that point. Yes.
Yeah, yeah. They should, because you're trying to find someone who's willing to go on this journey with you. If you're paying them,
It's
it's
going to
always
be
this.
equity based, like who are willing to go through the ground with you, because in the beginning it's going to be so hard.
Yeah, and they have to know it's a super outside chance, but you're really trying to find someone who's also a bit bored and like kind of unstimulated in whatever they're currently doing. That's the goal.
Yeah.
And there are plenty of those people out there. Just got to go to the right places.
Yeah, I agree. I completely agree. Yeah, I think you have to do search. I have a bit of experience in this. I don't know, like, so what I've been trying to do and what worked for us so far is like plain old cold emailing on LinkedIn, like sending
Yeah,
messages to people, like, hey, asking, say, hey, like, I have this idea, I want to do this X, Y, and Z. Is that something that interests
yeah,
you? I just want to jump on a call. And like, you might talk to them, they might not be interested, but like, you will learn. Like, you will learn, what do I need to run this product? They will tell you, will run into this problem, or run into that problem. You will need like this type of CPUs or GPUs. You will need this from NVIDIA. You will need this from Amazon. So you will learn through like talking to people.
yeah, exactly. Yeah, you just yeah, it's like you just need to have like momentum and inertia and like basically it's like if it's a chemical reaction, like you just need to be the one pushing it through. Like you need to like bump into people, like be sending cold messages, trying to find someone, and then there's some magic that happens. It just kind of works out in the end, or at least you bump into the problems that you need to solve to be able to make this thing real, which doesn't happen if you're kind of waiting or like you're too passive. Like it's hard. It's really hard to do new things.
Oh yeah.
Um, that they don't happen. Like the default state is like for it to die. Like you always have to be going against the grain to try to get something to stick. And most of the time it's kind of failing. And then eventually, if you're lucky, you get to something that can sustain itself, but it takes a long, long time. Like I say, only now as at Heidi, we're kind of in a position where like the product's kind of growing on its own. Don't get me wrong, I'm still worried about there's a million possible negative things that can come, but that's like a 5-year journey, really, from early idea to like getting
Oh
something that works.
wow.
It takes a long time. Yeah.
Yeah.
And lots of like, metaphorical punches in the face along the way. This is like takes a lot of work. Yeah. So, but I think that's part of the fun. Like, and most companies I think that have been successful are kind of like that. Because it's like a great filter. There's that like
Mm-hmm, mm-hmm, mm-hmm.
it's like the something to do with cosmology about like civilization and can you escape the planet and all this kind of stuff. But for companies, there's great filters as well. So it's like, can you get past first idea? Can you find co-founder? Can you like build anything that does anything? Like literally, like doesn't matter if it's good, just like something that works and does some feature. Then can you get that in the hands of customers and like try to find something that they're willing to pay for? Then given that, can you do go to market in a way that's interesting? Like how do you actually get users to use the product? You can't one-to-one call every user. And so like it's just all these like stage gates that if you get through them all, eventually you can get to a place where generally people like your product, people are willing to pay for it. Hopefully there's some marketing sales engine that works. And then you have other filters like, your competition, the large incumbents coming for you, you know, noise in the market. Anyway, it's just like it never ends. But there's different kinds of problems.
Yes, exactly.
And the
It's just
early,
like
yeah,
I think Elon Musk also talks about this, like being the founder of the company is like the hardest thing ever, because
yeah.
all the problems through the company filter and then come to you, and you only do with those problems that can be solved.
Yeah, exactly. Yeah, it's always whatever's like the worst, most painful thing at a given point in time is what you're trying to deal with. But there's lots of joy through it, and like it's really exciting to see both the users give good feedback, see something flourish, see people in your team grow is really good. It's a good feeling, like going from being an intern to full time to leading teams within the team. It's cool. So
Very cool. I don't want to take more of your time, but I just have like one last question. Is like,
yeah.
so let's say you will start this journey from all over again, or let's
Mhm.
say I'm a physician listening to this. What advice would you give yourself or someone else who's
Um,
starting this?
yeah. Uh, I think the one thing I would do differently next time would be just like stay really, really close to the customer all the time, and never get your hands out of the product. So um, yeah, like so it's a bit of the prosecuting the past, but our first initial reaction was to sell to organizations. So similar to what you said at the start, like we thought that groups and PE firms and health systems, like it made sense to sell top down. But what we found is that we were successful, so we figured out ways to do that. But then when we did ultimately sell, the clinicians were really difficult to get to use the product. Even though we knew that they would love it, it was just so hard because as doctors, whenever the administrators are telling us to use something, it just feels like,
Oh, I completely agree.
mean,
Yes.
yeah, it's something about like the way it's being forced on me. I don't want to use it. There's this like, ick. So I think with health products, that's a common failure mode that I didn't really think deeply about, because I thought I'm a doctor, so I automatically know what people are going to want. People are going to like it because I built it. That's not the case at all. Like, it has to really solve a real problem for them, and that's why we've spent heaps of time going direct to clinician and just obsessing about the clinicians, the feedback we get. Like, even when we sell to an organization, it's still ultimately about like that clinician experience. We're not trying to go too hard building a product that the organization wants, but before making sure that the clinicians really love it. Kind of like putting the cart before the horse kind of problem. Like, there's all these cool things you can do with AI if all the clinicians are using it. But step one, get all the clinicians using it. If 10% of them are using it, you can't do billing workflows, you can't do administrative stuff, you can't do anything, because 1 in 10 are using it. So none of the benefit is being captured. Um, and that's for me kind of, I'd say, like, just don't listen to the noise. Like, generally, outsiders don't have a good perspective on the problems you're facing. Don't take advice. Just really like focus internally. Take advice from people who have gone through the exact thing you've gone through and been successful, but really don't take advice from people who are just trying to get a few bucks or some shares and giving you their 2 cents at an inch deep level. So an example of that at the moment is like, if you ask like general industry bodies about AI space, it's a lot of it's like, oh yeah, they're all the same, or note gen. It's almost like a meme. Like, every other YC company is a note generating company. But if you get down to it and try the products, like, they're not that great. They're not stable. They don't really solve the problem. It's super easy to do the initial trick now. So like, the barrier to entry has gone away. But to make it just amazing, every visit, every clinician, every part of the hospital, or even your own work, every type of visit that you do, there's still a really hard problem. And there's this urge to like go quick to launch more features and make it more complicated and like do all these other things. But it doesn't actually have to be like that. Every other software category, whether it's like Notion versus Word, like, why would you use Notion? Like, it's the same thing. Why would you use Slack instead of using Teams? It's because the product's better and it just
Yeah.
is way, way better. And is it a bit confusing for customers? Yes, but like, the cream kind of floats to the surface, and that's what I think. That's why we focus on just like making the absolute best version of this tool, like singularly focused on that. Can we get 50-60% of the clinicians using this every day after it's released? And then once we win on that, then we move on to other battles. But for now, we're just focused on that one battlefield. So I think for anyone starting a company, just be really focused on who your customer is, like the actual like end user of the product, who makes sure that they really love it and spend heaps of time with them. That should be the first thing you do. Don't worry about business models or like who you sell to or how you make money too early on. Just make sure it's something that really solves a deep problem, because I promise you, you'll be able to figure out the rest. The hardest thing is getting someone to love the thing you've built. That's the hard part. Everything else is easy. And business people and MBAs can help you with the other part. But the hard part is, can you get them to use the new thing, the new cannula, the new software, the new whatever, ECG machine, like whatever it is. That's the hard part. Make sure that thing works, and then there will be people and support you can get to find the business. Yeah.
I love it. I love it. Yeah, I completely agree with you. I think like, if the customer doesn't use your product, like, it's worthless. And making a physician also, like, I think physicians in general are like hard to please group of customers. Yes, for
Yeah.
sure. Yes, we're very picky. We're very like, have like lots of things we have to consider, and it's people's life we're dealing with. But yeah, I completely agree with you.
Yeah.
Thank you so much. I really, really appreciate it. I really appreciate being you
No,
here
no
today and
worries.
sharing all this things about Heidi and about your journey. Thank you so much.
No worries. Thanks, Rupin. No, it was great to be here.
Thank you so much.